Risperidone is a second-generation antipsychotic medication used to treat a number of mental health disorders including schizophrenia, bipolar mania, psychosis, or as an adjunct in severe depression. In this video, let's find found. What is risperidone? What class of drug is risperidone? What is risperidone used to treat? Who cannot use risperidone? What are the side effects of taking risperidone? How does risperidone make you feel? How to use risperidone? What is risperidone? What class of drug is risperidone? Risperidone, sold under the brand name Risperdal among others, is an atypical antipsychotic used to treat schizophrenia and bipolar disorder. It is taken either by mouth or by injection. The injectable versions are long-acting, last for 2 to 4 weeks. Study of risperidone began in the late 1980s and it was approved for sale in the United States in 1993. It is on the World Health Organization's list of essential medicines. It is available as a generic medication. In 2020, the 138th most commonly prescribed medication in the United States, with more than 4 million prescriptions. What is risperidone used to treat? Risperidone is indicated for the treatment of schizophrenia and irritability associated with autistic disorder. It is also indicated as monotherapy, or adjunctly with lithium or valproic acid. For the treatment of acute mania or mixed episodes associated with bipolar disorder. Risperidone is additionally indicated in Canada for the short-term symptomatic management of aggression or psychotic symptoms in patients with severe dementia of the Alzheimer type unresponsive to non-pharmacological approaches. Risperidone is also used off-label for a number of conditions, including as an adjunct to depressants in treatment-resistant depression. Who cannot use risperidone? Risperidone is contraindicated in patients with a known hypersensitivity to risperidone or paliperidone, or to any of the excipients in the risperidone formulation. There is a risk of serious hypersensitivity reactions or anaphylaxis. What are the side effects of taking risperidone? Common side effects include movement problems, sleepiness, dizziness, trouble seeing, constipation, and increased weight. About 9 to 20% of people gained more than 7% of the baseline weight, depending on the dose. Serious side effects may include potentially permanent movement disorder tardive dyskinesia, as well as neuroleptic malignant syndrome, an increased risk of suicide, and high blood sugar levels. In older people with psychosis as a result of dementia, it may increase the risk of death. While atypical antipsychotics appear to have a lower rate of movement problems as compared to typical antipsychotics, risperidone has a high risk of movement problems among the atypicals. Atypical antipsychotics, however, are associated with a greater amount of weight gain and other metabolic side effects. Pharmacodynamics. The primary action of risperidone is to decrease dopaminergic and serotonergic pathway activity in the brain, therefore decreasing symptoms of schizophrenia and mood disorders. Risperidone has a high binding affinity for serotonergic 5-HT2A receptors when compared to dopaminergic D receptors in the brain. Risperidone binds to D2 receptors with a lower affinity than first-generation antipsychotic drugs, which bind with very high affinity. A reduction in extrapyramidal symptoms with risperidone, when compared to its predecessors, is likely a result of its moderate affinity for dopaminergic D2 receptors. How does risperidone work? Though its precise mechanism of action is not fully understood, current focus is on the ability of risperidone to inhibit the D2 dopaminergic receptors and 5-HT2A serotonergic receptors in the brain. Schizophrenia is thought to result from an excess of dopaminergic D2 and synergic 5-HT2A activity, resulting in overactivity of central mesolimbic pathways and mesocortical pathways, respectively. D2 dopaminergic receptors are transiently inhibited by risperidone, reducing dopaminergic neurotransmission, therefore decreasing positive symptoms of schizophrenia such as delusions and hallucinations. Risperidone binds transiently and with loose affinity to the dopaminergic D2 receptor, with an ideal receptor occupancy of 60 to 70% for optimal effect. Rapid dissociation of risperidone from the D2 receptors contributes to decreased risk of extrapyramidal EPS, which occur with permanent and high occupancy blockade of D2 dopaminergic receptors. Low affinity binding and rapid dissociation from the D2 receptor distinguish risperidone from the traditional antipsychotic drugs. A higher occupancy rate of D2 receptors is said to increase the risk of extrapyramidal symptoms and is therefore to be avoided. Half-life: 3 hours in extensive metabolizers, up to 20 hours in poor metabolizers. How to use risperidone. Schizophrenia. PO, Risperdal or Risperdal M-tabs. 2 mg per day initially, may increase in increments of 1 to 2 mg/day at intervals greater than or equal to 24 hours. Recommended target dosage, 2 to 8 mg/day daily or divided Q12HR. Efficacy follows bell-shaped curve. 4 to 8 mg/day more effective than 12 to 16 mg/day. Bipolar mania. PO, Risperdal or Risperidal M-tabs. 2 to 3 mg/day initially, may be increased if necessary in increments of 1 mg per day at intervals of 24 hours to 6 mg per day. Dosage recommendations not available for treatment duration 3 weeks. Tourette syndrome, off-label. 0.5 to 1 mg/day PO. May be increased or decreased in increments of 0.5 mg Q12HR at intervals greater than 3 days, not to exceed 6 mg per day. Post-traumatic stress disorder, off-label. 0.5 to 8 mg/day PO. Are there specific concerns about risperidone and pregnancy? US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women, despite potential risks. That's all the information about risperidone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.